Hello everybody, welcome back to my Knowledge Academy channel. It's for ANM, GNM, BPCCHN, BSc and MSc nursing students. It's time for Community Health Nursing class. I am Mithu, Public Health Nursing Officer. Health cannot be measured at the exact measurable form. There are some measures of the health status, but unfortunately there is no unitary objective measures of the health status, because health is not only the abstract but also very complex. It is multidimensional, dynamic, subjective and relative also. There are many factors which are required to measure the variables, and they are called indicators. They are called indicators because they indicate or give some clues about the health status. If you assess the health status of the pupil, you should have enough knowledge regarding the indicators of the health. So, our today's topic is indicators of the health under the chapter of concept of health and disease, part 1. So, let's go. Indicators of the health. At first, we should know the meaning of the indicators. Indicator means a gauge or a meter of a specified kind or a thing that indicate a state or level. But what is the meaning of the health indicator? Health indicator is a measure designed to summarize information about a given priority topic in health of population or health system performance. That means health indicator is such a measure, and it is making in such a design that helps to summarize the information regarding any topic related to the health of the population or health system performance. And health indicators are the quantifiable characteristics. Quantifiable characteristics of a population which researchers use as supporting evidence for describing the health of the population. At first, we should know what is the quantifiable characteristics. Quantifiable characteristics means able to be expressed as an amount, quantity or the numerical value. Amount. Amount, quantity or the numerical value. Numerical value. That means something that is capable of being measured or counted. Example, a quantitative characteristics of the thermal state of the body. It may be centigrade or it may be Fahrenheit. As for example, 98.4, 98.6 degree Fahrenheit, 38 degree centigrade, 37.5 degree centigrade, etc. And weight of a person in kg, 50 kg, 60 kg, 40 kg, 30 kg, etc. And examination marks. Out of 100, 30, 50 out of 100, 150 out of 200, etc. That means all have the numerical value, or they are all the amount or the quantity. So health indicators are the quantifiable characteristics. That means they have the numerical value or quantity or the amount. Indicators are the markers of the health status which form the base for the assessment of the health. And indicators are only an indication or a reflection of the situation. That means, as the name implies, indicators are only an indication of a given situation or reflection of that situation, and they are defined as the variables which helps to measure the changes and provide the factual information. Factual information about health service performance, and they can be used to measure the progress towards fulfilling the establishing goals and targets, including the monitoring of the changes in the health status of the population. And it is used particularly when changes cannot measure the directly. As for example, health and the nutritional status. This is because health, like happiness, it cannot be defined in the exact measurable terms, and its presence or absence is so largely a matter of the subjective judgment, since we have problem in defining the health, and they indicate the direction and speed of the changes and serve to compare the different areas at the same moment in the time. That means it indicates the progress or the failure and how fast or how slow the changes occurs, and also compare the health status of the population at the same time in different geographical location, and it forms the base for the assessment of the health. Indicators versus index and its application. There has been some confusion over the terminology health indicator and the index. Health indicator is the singular form, whereas index is the plural form. It has been suggested that in relation to the health trends, the term indicator is to be preferred to index, whereas health index is generally considered to be the amalgamation of the health indicators. Compound and the composite indicators are called the indexes. An application. Health indicators are often used by the government in their healthcare policy. Importance of the health indicators. They are, number one, to measure the health status of a community. Health status means both the condition of the physically and the mentally, and health indicator is a variable and susceptible to the direct measurement that reflect the state of the health of a person in a community, and health status of the community is measured in terms of the mortality, morbidity and disability. Mortality means the rate of the death within a population. As for example, infant mortality rate, maternal mortality rate, etc. And the morbidity means the rate of the incidence and the prevalence of a disease. And the disability means the state of the being unable to use a part of our body properly, and usually because of the injury or the disease. Once again, disability means the state of the being unable to use a part of the body properly, and usually because of the injury or any disease. So the indicators of the health measures the health status of the community in terms of the mortality, morbidity and the disability. As for example, here the infant mortality rate of the India. This table indicates a vivid pictures of the IMR in India. In 2015, the IMR was 36.249, and in 2016 IMR was 34.833, and 2017 33.416, and in 2021 it is decreased in 28.771. So this table indicate the IMR is decreasing. IMR is decreasing day by day. So it gives a clue of the health improvement considerably. So we can say that the indicators of the health measures the health status of a community. And next, to compare the progress of track of the health status between the country to country. At first we should know what is the meaning of the progress. Progress means forward or the onward movement towards a destination, and it provides a comparable and the actionable information across the different geographic or the organizational or the administrative boundaries. That means between or among the country to country, or it can track the progress over the time. What is the meaning of the compare? Compare means it is capable or it is suitable for the comparison between or among the information. And actionable. What is the meaning of actionable? Actionable information means it is used for the implementation purpose, and that means this information can be used in the decision making and in any program. So one example, that comparison of the countries by IMR. Infant mortality rate of the Pakistan in 2021 is 57.998, and Zambia 41.857, Kenya 32.913, India 28.771, and Ukraine 6.465. So this table shows the different infant mortality rate among these countries. So it compare the progress of the track of the health status between country to country. And next, to assess the healthcare needs. Assess the healthcare needs. Healthcare needs are those that can benefit from the healthcare. It may be health education, disease prevention, diagnosis, treatment, rehabilitation, terminal care, etc. And indicators of the health recognizes the deficit area. That means it assesses the demands of the care in the population. So deficit area and demands of the care. And demand of care. Mortality and the morbidity data offer the information on the burden of illness, burden of the illness for different types of the health problems. So according to this data, government can assess the healthcare needs and take the necessary strategies and the planning for achieving the targets of that program. And next, to allocate the resource. To allocate the resource. Resource means Resource allocation. Resource allocation means the distribution of the resources, usually financial fund, it may be human resources, facilities, various types of the facilities, knowledge, updated materials, and these resources should be used to treat the disease and relieve the pain and the suffering, promote public health. So indicator identify the type, place and the amount of the resource, what type of the resource is needed. And next, to monitor and the evaluate. To monitor and evaluate the health services, activities and the program. During monitoring and the evaluation, we can realize or identify that public utilizes those services or not, and how many percentage of the population actually benefited by this service. So it gives a clue for the future planning and helps to measure the extent to which the objectives of and the targets of a program are being attained. That means indicators are the signs of the progress, and that means it is a measure of the health success. As for example, the proportion of the infants who are fully immunized, and in COVID vaccination, how many percentage of the population have fully vaccinated or completed their vaccination, or how many person has incompleted or the due. Or in the polio program, percentage of the coverage, that means how many children has taken their polio vaccine, that denotes the program's success or the failure. So it helps to measure the extent to which the objectives and targets of a program are being attained. And next, characteristics of indicators. A health indicator which will be used internationally to describe the global health should have some characteristics, and it should be defined in such a way that it can be measured uniformly. Ideal indicators should be valid, reliable, sensitive, specific, feasible and relevant. Valid. What is a valid? They should actually measure what they supposed to measure. It must have statistical validity, an accurate measure of a behavior, practice, task, that is the expected outcome or the outcome of the interventions. That means the result satisfy the objectives. As for example, a sphygmomanometer is a blood pressuring instrument, and it is supposed to measure only the blood pressure, and it cannot be considered a valid instrument if it is measured other than the blood pressure. So indicator must have the appropriateness, completeness and usefulness of the attributes. Once again, valid means it actually measure what they supposed to measure. That means result always satisfy the objectives. Next, the reliable. Reliable means the degree of the consistency with which the variables are measured. Reliability refers to the consistency of a measure. The answer or the result should be the same if measured by the different people in the similar circumstances. Consistently measurable over time in the same way by the different observers. As for example, a glucometer is a glucose measuring instrument that gave for one individual, it gives a reading of 110 mg per dl. After sometimes when it is again used for the same subject by the different investigator in the similar circumstances, it gives the same result. So result will be the consistent, or result are the consistent. Sensitivity. Next, the sensitivity, the change in the situation concern. They should be sensitive to change in the situation concern. In medical terms, sensitivity, sometimes it said that sensitivity is the percentage of the people who have tested a positive result for a disease that have that disease, and highly sensitive tests are often used as the screening test, and a highly sensitive test will essentially rule out those who do not have the disease. In community health, example of the sensitive, that is the duration of the marriage appears to be more sensitive indicator of the timing of birth than does the age of the woman, or it would be appear that this assay is the sensitive indicator of an infection. Next, the specific. What is the meaning of the specific? They should reflect the changes only in the situation concerned, and an indicator should define in precise, unambiguous terms what is clearly and exactly in nature or being measured. The words improved, increased, decreased do not belong to an indicator. And as for example, in a locality 20 fever cases have been reported. Diseases like the malaria, COVID, dengue causes the fever. So indicators of the health measures that how many people suffers in fever from malaria, or how many from the dengue or COVID. Maybe 15 or maybe 12 out of the 20 people suffers from the COVID. But it should not be reported that when maximum number of the people suffers from the COVID, then all the cases are the COVID, not in a generalized manner. But measurement should be the specific, that is out of 15 out of 20 malaria, or 12 out of 20 COVID, that is the specifically. That should be specifically, not in the generalized. Next, the feasible. That is the feasibility. They should have the ability to obtain the data what is needed, and feasibility describes how easy or difficult it is to do something. When you set a goal at work, or think about a long-term feasibility of accomplishing what you want. When people talk about the feasibility of a project, they are discussing whether or not it can be achieved. How doable is it? Example, if we study regarding the immunization coverage of 0 to 5 years children, we select city A. But after some day, we knew that pupil of the city A is highly migratory in nature. So, due to migratory nature of this pupil, the measurement of the immunization coverage of 0 to 5 years children is not feasible, because several times survey are needed for actual measurement. So, next, health status and the health determinants indicators. Health status indicators. Health status indicator measures the different aspect of the health of a population. Different aspect of the health of a population. That means the life expectancy, mortality, morbidity, and disability, etc. That means health status indicators measures the different aspect of the health of a pupil or population. And health determinants indicators measures the things that influence the health. They do not directly measures the health, but it influences the health. That includes diet, water quality, income, and access to the health service. Access to the health services. So they all influence the health indirectly. So our various types of the indicators are they are mortality indicators, morbidity indicators, disability rates or indicators, nutritional status indicators, and indicators of the social and the mental health, socio-economic indicators, environmental indicators, and healthcare delivery indicators, utilization rates, and health policy indicators, and indicators of the quality of life, and other indicators. We will discuss all those indicators one by one, and at first mortality indicators will be discussed in the next video of the community health nursing class, and other indicators will be discussed in the community health class only. And our coming video is MCQ and its explanation on anatomy and physiology. And till then, stay tuned. Thank you.